You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Voices from the Frontline is a new podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of AAPCHO's member health organizations. In this episode, AAPCHO's Membership Relations Associate Grace Sonia Milano asks Dorcas Grigg-Saito, CEO of Lowell Community Health Center, to break down the often generalized cost of healthcare and shed light on the specific financial burdens medically disadvantaged populations face.
Hello, Dorcas. Thanks for joining me on the phone today. Would you mind introducing yourself to our podcast listening audience?
Dorcas Grigg-Saito, CEO of Lowell Community Health Center in Lowell, Massachusetts.
Great, thanks again. Earlier this year, you testified at a Massachusetts state hearing regarding the overall out-of-pocket affordability of your state's new health insurance product. Can you tell me a little bit about what you shared with legislators that day?
The testimony was really related to affordability of the health insurance product, and in Massachusetts, in addition to Medicaid, we also have two products that are called Commonwealth Care and Commonwealth Choice. Commonwealth Care is for people who are not, for whatever reason, eligible for Medicaid, but they have incomes under 300% of poverty, and they, depending on where you fall in that spectrum, you may, towards the higher income of that, have copay. I think it's just copays for Commonwealth Care. And then for Commonwealth Choice, it's 300% of poverty and above, or actually it's for any income category. And you pay a premium and copays depending on your income. So what I talked about in the hearing at the State House was the issues around the affordability related to out-of-pocket expenses. And so if you have copays and deductibles and premiums, it many times forces patients to choose between maintaining their insurance coverage, or many times they also have a lot of past medical debt, paying that off, filling prescriptions, or getting needed care. And if you have someone who has a number of chronic illnesses, and particularly if they haven't been receiving care because they weren't insured until healthcare reform came in, that they're frequently seeing their primary care doctor, they're seeing one or more specialists, they may need an eye exam. If you take the example of someone with say, diabetes, hypertension, high cholesterol, and need to see the primary care provider regularly, 1 or 2 visits a year to an endocrinologist, eye exam, podiatry care, and probably at least 3 medications. So if the level was between 150 and 200% of poverty, there'd be a $15 copay for each primary care visit, $22 for the specialty visit, and $12.50 or even up to $50 for each prescription. So on the conservative side, the patient would have $55 a month in out-of-pocket expenses, in addition to the $40 to $60 premium. So when you look at it that way, for many people, that would not be affordable. So that was kind of the nature of the testimony.
So, how did the audience react? Is this all information that they've heard before, or was this new information to them?
Well, I sensed that perhaps they had heard this before, and that it was good to be reminded, and to, what I tried to do was put together an actual example of how much it would cost in a month. And I think that meant a lot to them, to think, if you're living under 200% of poverty, and these are the things that you're having to pay, that it could indeed add up to more than a person of that income level could afford.
What are your top 3 wishes for a health care reform bill?
If I can narrow it down, well, there definitely should be a focus on preventive and primary care, and in order to do that, there has to be a focus on capacity building in terms of available primary care providers. Important, as I said, to focus on access, which includes health insurance, cultural competence, linguistic access, and under access we could include also access to behavioral health and dental care, because we often health insurance and health systems forget about kind of from the neck up. Guess the last one would be affordable for the patient, and rates that are adequate for the provider. Well, certainly the access, in my mind, needs to include access for legal immigrants, and without the 5-year wait that we're seeing right now. That's critical for immigrants who are paying taxes and are not able to qualify for payment for assistance with health care.
Well, Dorcas, thank you so much for joining me today.
Thank you, and thanks for all that AAPCHO does for all the communities.
Thanks for listening to AAPCHO's Voices from the Frontline, conversations illuminating our vision of equitable, affordable, and culturally appropriate healthcare for all. Please join the conversation on our Facebook fan page at www.facebook.com/AAPCHO.